Welcome in the new episode of Newsroom. I'm Alexis Descata, and today we will talk about return to work. A recent paper, very interesting, published in a rehab journal dealing with this interesting fact among a large cohort of and specialists with 1 year of follow-up. They include a patient from seven clinics, rehabs, and a patient with acute and injury or calling manual workers. We have questions about exposure, legal contents, functional limitation. So these patients, most of them return to work in approximately 3 months in median, and the mean was longer. Some of them return with reduced working hours, and some of them with work restriction. And it's really interesting that we have medical components that are limit the return to work, as well as legal components, psychological components, and also occupational components. And so there's limitation in this paper about the analysis, the selections. Many different disorders include what is the real work of this patient. However, which is really interesting, it's uh, and practitioner should also consider as well as medical factor, also occupational and legal factor. And this is really interesting to be known by our colleagues from other specialty like hand surgery and rehab. So thank you and see you next week.